Hello, hello, hello. You're listening to Aurat, Dilse Desi. Aurat is a podcast for brown women by brown women who dare to raise their voices. This is a special Meet an Aurat episode where you, me, and we get to meet a very interesting and very daring Aurat. So Geet, Dr. Amna and I caught up with Dr. Sadaf, aka the Savvy Woman's Sex Coach, who is also a board-certified OBGYN, life coach, and sexual counselor in New York, with over 22 years of experience in helping women and adolescent girls with their physical and emotional health issues. She started her social media presence in 2021, and in 2022, Dr. Sadaf kicked off the Muslim Sex Podcast, where she talks about sex and other topics important for female health. An OBGYN, mom, and Muslim, she talks openly about topics your mom may have never spoken to you about. No shame, no judgment, and no topic is taboo. That's absolutely where our stars aligned, and we're so thankful to have her on Aurat. Her motivation was to be that sex resource she never had, and to create an online space that's safe for primarily Muslim women to talk about sex and take a sex-positive approach to their relationships. The conversation is just getting started. Let's go meet an Aurat.
Hello, Aurat.
Hello, Aurat.
Hello, Aurat.
Hello, Aurat. Welcome back, ladies. Dr. Sadaf, thank you so much for being here. We would love to kick off with the first sort of just getting to know you. And we hear that you are a Muslim sex coach. And so what led you to become a Muslim sex coach?
Hi, thank you so much for having me on and for giving me the time and space on your episode and on your podcast. So I am a gynecologist. I'm an OBGYN by training. And I noted that, I've been an OBGYN now for, including residency, for a total of 22 years. And in my 22 years of practice, I noticed that we really lacked, just in general, but also within the Muslim community, and really just South Asian, right? It doesn't have to be specific to Muslims, but really just somebody that talks about sex and is sex positive, right? So it's not a matter of being vulgar or obscene, because that's not who I am and that's not my style, but it's just about having a space that is safe for women to discuss topics on sex and to talk about sex in a sex positive manner. And I didn't see any. And, in case I missed somebody, I could be remiss, and perhaps there are people out there, but I didn't see anyone. So I felt like I needed to create that space. And so that's what led me to that. And I just wanted to be that resource that I never had and create a space for people that, identify as women, and for women, so that they had a space.
Over time, how has that gone for you? I mean, just even identifying yourself as a Muslim sex coach, how has that sort of like been received, perceived?
Yeah, so it's been quite the journey. So this whole idea came about really this year. So like I would say in January, February, I went to do something online, and that kind of is what led me to this life coaching. And I really enjoyed it because it really helped me grow as well. But in terms of answering your question, how has that been received? So I've had my social media presence since November of this past year. And let me tell you, it has been quite the journey. I get very interesting comments. In fact, this week, so I was on call. I was on call at the hospital this past Sunday, and I did something that I should never do, which is read my comments in TikTok, the comment section, because a quarter of them are about, well, is she really Muslim? And oh my God, where's her modesty? Where's her this? Where's her that? And oh, she doesn't wear hijab, and look at her. And it went on and on, and I was like, oh, and some people are like, oh, astaghfirullah, and stuff. So then I was like, what the, and this is not the first time. I mean, there's, lots of trolls, right? So
the purity mob was after you.
Yes, absolutely, 100%. And so at first I was like, oh wow, this really sucks. But but to counteract that, there's a lot of women, and not just women, but other people on there that, support what I'm doing, and, saying all these nice things. But of course, the things that always get stuck in our head are the negative comments, right? So I was just thinking about them, and then I thought, gosh, should I even bother? I mean, the social media thing, whatever. And then I came home and I was discussing with my children. My children are so sweet. They're like, Mom, are you going to really let, somebody on social media dictate and tell you what you should do? And, Mom, if you don't have haters, that means you're not doing it right, all that stuff. So I appreciated that. I mean, my whole why, right? So the why do I even do this? It's to empower and to educate women regarding sexuality and sex, and the importance of it, and why they should feel empowered to know what they like and to be able to communicate that with their partner, and that is my why. So that's what keeps me going.
During our research, it seems like, and also just talking to people, majority of South Asian women, it feels like sex is a chore or they're dissatisfied. What are some of the reasons for this? And what are some of the solutions?
Sure. So, I, like any big group or community, South Asian women are not a monolith, right? So there's not one thing that is pertaining to everyone. But I agree with what you say in terms of women finding it to be a chore. Oftentimes women that I speak to say that they don't enjoy sex, that perhaps some of them find it dirty or shameful or painful, and that it's not something that they desire as much. There are some women that do enjoy sex, but for the most part, it would be women that primarily are unsatisfied with sex. And, I'd like to say that I feel it's a way that we are raised. Now, I'm speaking for, the people that I've come across. Obviously, I can't speak for everyone, but, oftentimes women, so now I'm speaking, since I am like a Muslim sex coach, speaking of like the Muslim women, and perhaps even I think it would extend to perhaps South Asian women in general, is that, oftentimes we don't, or they don't have sex before marriage, right? So that the first time that they have sex is marriage. So in fact, I was just talking about this with the sex coach that I was speaking with on my own podcast. And we were discussing how it's very difficult for some women to make that transition, right? So all your life, you're told, you stay away from sex. It's bad. It's dirty. It's protecting, right? So it's not that you're being told that from, at least not, hopefully, you think that it's not being told to you from a bad place, but one of like a protective, right? So people are trying to protect you and saying, stay away from that. It's not good, whatever. But then when you get married, all of a sudden now you're supposed to be like enjoying sex and liking it. And that is a transition that doesn't just happen overnight, right?
Yeah, that seems like a sudden flip from like none to like 0 to 100.
Right? Like, women are all of a sudden in bed supposed to be like nymphomaniacs or something like that. That doesn't really happen for a lot of women. And so it's a lot of trial and error. It's a process. And I think that women, South Asian women, should take it as such, right? That it's a process and it's a journey, and that they have to be kind to themselves and understand that they're going from a place of perhaps nothing to now there's opportunity and they can experience something, and that, that the change is going to happen over time, and that there has to be like a shift in mindset almost, right? That's where a coach will come in, because there are different ways of looking at sex and sexual pleasure. And if you change the mindset from something that is shameful or dirty to now something that's joyful and pleasurable, and can elicit pleasure, then you automatically change the expectation and what can come about, right? So I think that a change in mindset has to come, but that it will be gradual, and for women to give themselves grace and allow that time to happen naturally over time. Right. And that all begins with communication. So being able to tell your partner that, what you want and how fast or slow you want to get there to that point. And that if it's not the best, if sex is not the best the first time you have it, right, which for most people it is not, then to give yourself the time to let it become that eventually, if that's what you want, right? It all depends on what the woman wants.
With South Asian women and even Muslim women, I think there's so much shame attached to that. Besides communication, because that also depends on the other person, right? Like you can communicate, but if that other person's not going to communicate with you, that's not probably going to work in the long run either. So even with that sort of shame spiral that we go through, what would you say is what can we do to address that shame? Because even whether it's before marriage or after marriage, whenever you're having sex, I think that still holds back how much or how comfortable you are, I feel like.
Our thoughts, right? Our thoughts result in our feelings, and our feelings result in emotions, which result in our actions, right? But it has to start from the thought. So what do we believe about sex? Or what do we believe about pleasure? How do we see that? How do we see sex? So if we see it as shameful and dirty and painful and all this stuff, then the actions that we take will be a result of those thoughts, right? But if we are able to change our thoughts around what sex is and what it means to us, then our actions will follow. And we have to journey into our thoughts, right? So it's speaking with either a therapist or a coach or somebody that can help you to dive deeper into your thoughts and see where these thoughts came from, where they originated from, and to know that you have the right to choose how you believe and what you believe, right? That these thoughts can come, but you have a choice. You can either keep those thoughts if they're serving you, but if they're not serving you, then you can choose to let them go. And an analogy that I always give my clients and patients is that, to me, thoughts are like little clouds over my head, or they're like balloons, right? So if they're serving me, I'm going to hold on to them. But if they're not serving me, I'm going to let them go. And it's easier said than done, but I think it's a practice that you have to do, and you have to stop yourself. And that's where mindfulness comes in as well, right? So we have to, when we start to have thoughts, and when we start to have feelings, and when we start to act on those feelings and emotions, we have to see where they're coming from, and then see if that original thought is serving us or not. And I think the biggest thing in coaching is that you have a choice, right? And that you can get curious about your thoughts, and that curiosity, and think about like, well, I may believe that sex is bad or sex is shameful and dirty, but where did I get those thoughts from, right? Where does that come from? Does that come from my upbringing? Does that come from the way that I was raised? Maybe, and some people have trauma, right? We can't ignore that. There's a lot of sexual abuse that happens. Some of the thoughts that can happen because of trauma. And so that's why it's so important to examine our thoughts and then get the help that we need by whatever means, whether it's a provider, whether it's psychiatrist, therapist, whoever is able to help you to understand your thoughts.
And it doesn't have to be sexual trauma, right? It could be any sort of trauma.
Verbal abuse, right? It could be anything. It could be any type of trauma that occurred that has caused us to believe a certain way.
Like, as you're, in your experience as a doctor, as a coach, what would you say are some of the like more frequent questions that you get from your like whether your clients or people even on TikTok or your social media channels? What are they like some of the top few things that you've heard over and over?
Yeah, absolutely. So aside from the why I don't wear hijab, because that comes up all the time. But right. So some people comment about painful sex. That's a huge one. It's huge. Other people talk about decreased libido, right? Vaginal dryness. But really painful sex comes up a lot. So I think that those few things, I'm trying to think about what other things come up. Oh, yes. So I also have vaginismus, right? With vaginismus for those people that are not medical professionals that might be listening.
Like me.
Vaginismus is when you have contraction of the muscles of the lower third of the vagina that can happen even before you have intercourse. So you're anticipating those muscles contract because you anticipate pain. And that's what vaginismus is. So it's involuntary contraction of the lower third of the vagina in anticipation of pain. So someone can experience that, say, even while they're, perhaps placing a tampon in, right? Some people get like that when they go to a gynecologist and they're getting a pelvic exam and they're anticipating pain. And so their muscles contract. I see that a lot when a woman is in labor and I have to check her cervix to see if she's dilated, and automatically she'll contract and say, that she feels pain even I haven't even touched her yet, So it's the idea.
Is it more sort of psychological then? Like,
yes, it is. Okay. But so then I don't want to just say it's completely psychological,
sure.
Right? Some women can actually have, may have experienced trauma, right? Some people can have some anatomical pain, right? So for example, women in menopause, if they have vaginal dryness, they could be experiencing penetrative pain, right? So sure. When they have a lot of vaginal dryness, if their tissue shrinks, their vagina. So the vagina is such that like you either use it or you lose it, right? So that's why it's encouraged for women to continue to have intercourse as they age, because that'll keep the blood flow coming to the vagina and that area to keep it plump. Of course, there are women that also need estrogen to help that tissue. And some women even use a little bit of testosterone to help with that tissue so that it doesn't become so thin. Because when we go through menopause and the ovaries stop working, we have a decrease in estrogen. That decrease in estrogen can cause vaginal dryness. And when women have vaginal dryness, that can cause pain when they have intercourse. So there's ways around it. So that's why it's very important for women to go see their healthcare provider so they can be treated. But yes, so definitely, the painful intercourse can be what causes women, or, the history of painful intercourse can be what causes women to experience this vaginismus.
Yeah, I have a follow-up question to this. So as part of solution, do you suggest masturbation to women? So self-exploration, because communication will come when I will know what makes me happy. And to me, it makes intuitive sense to have masturbation as a solution. So I should first get to know myself. Then I can tell my partner what I want or not want.
Sure, of course. And that actually we spoke about a little bit in my podcast as well. So masturbation depends on, right, like how. So masturbation can be controversial depending on who you speak to, right? So some women definitely don't feel comfortable with their bodies. And so masturbation is, the way to go. However, some people who are religious, that may be Muslim, may find that they're not sure if it's allowed or not. So I'm just going to speak right now to the Muslim women in this who may be listening. And, other people that either are not Muslim or don't really, it doesn't matter to them, or may not be practicing, that's not a big issue. But for some women that practice and are concerned, there are different schools of thought regarding masturbation. Some schools of thought completely prohibit it. Other schools of thought say that it's fine in regard to having, your partner stimulate you to orgasm, and so that's fine. And other people say that masturbation is okay as long as nothing enters the vagina. And other scholars say that you can, if a woman say that she doesn't have a spouse or a partner, and she's afraid that she might commit adultery, then it's okay to put something in the vagina. So I guess it just depends on how religious a person is. Now, say if somebody is not religious at all, right, and this religion doesn't matter to them, then yes, you are right. Masturbation would be a good way to find out what you enjoy and what pleasures you. And, if you're also discovering orgasm, right? Oftentimes women are able to orgasm on their own, and maybe not even with a partner, but on their own.
I think we're team masturbation here.
I'm sorry, what? You're team masturbation.
We're team masturbation.
Yes, we talked about that in our self-care podcast too. I'm just going to make a comment to that. I mean, to men, this is a natural thing, right? They have to masturbate because young men get morning erection. So, or they have to masturbate to stay, non-erect all the time. So I don't know. I don't want to. Yeah. And for women, because it's more complicated, right? Our pleasure is more complicated. So it just makes sense that I first get to know.
But is our pleasure really that complicated?
No, that's what I'm saying, that our anatomy is not as simple, right? So first I have to know, and I'm one of those women who thought I never touched myself before I started having sex. Maybe I should have, then I would have known. But please,
let's not get into your
But that's what I'm saying, that Sadaf is right, that's a belief that's given to us, but I wanted to get an opinion from an expert that yes, and that's what you're saying, that yes, physiologically masturbation would be the best way to get to know yourself, and so you can communicate to your partner what you want.
Correct. And it's, and also, what you like, right? So if you know and understand your body and know what you like, then you can communicate that to somebody else.
Yeah. What would you say if you sort of say, okay, so communication, this is something that you want to practice. So let's say you're talking to a client, right? And they say, well, I try to communicate, but my partner doesn't want to talk about it because, I don't know, a whole host of reasons, right? One of them maybe being that he feels shameful, or the other person, whoever that is, feels shameful about it. How do you what is something that, that you would say to that person? How do you sort of open that communication up so it's two ways?
Yeah, I mean, that's a tough question, right? Because oftentimes that happens, whereas it might be one-sided. Communication is one-sided, right? So you have one partner who is very open to discussing their sexual health and their sexual wellness with their partner, and the other partner is like what you said. They're embarrassed, they're ashamed. Perhaps they don't think it's important, right? That they have everything else in their relationship, and perhaps sex is the only thing that's not that great, but their partner doesn't see it as important, or they feel inhibited. What do you do? Mm-hmm. I think that at that point, then you have to definitely speak with a therapist, right? A sex therapist that does couples counseling and gets the other person, because that's the only way things will move forward. Is that if they continuously shut down the conversation, then that conversation never happens. And I think with most couples, that conversation never happens because it's, either they never grew up with the idea of sex being positive, and that it's not shameful or dirty or painful or all this stuff, right? It couldn't be painful, but that it's, shameful or dirty. And then that conversation never starts. So you're asking what would be a conversation starter. And I think that if one partner is definitely opposed to talking about it, then they would have to seek professional help, because if that person's not going to open up, then that conversation is a no starter.
When you say most couples, are you referring to Muslim couples, or are you referring to just generally?
I think I feel like I could say generally. I feel that a lot of couples do not discuss sex. Whereas it's similar, right? Like sex, money, those topics are not often discussed, but are some of the most important topics and conversations to be had.
Right. And oftentimes women are actually kept away from those conversations purposely, right? So we're never really involved in the finances, and, but obviously we need to change that too. So in terms of like moving forward, what is it that you want to see in the world as a sex coach? Like you're sort of devoting your time, your effort, your resources, everything to increasing awareness, increasing understanding of sex. What is your vision? Like, what is your hope for the world? What is your hope for Muslim women? What is your hope for South Asian women, or Aurat that are listening today?
Yeah, you know what I think? What I think would be wonderful is that if we had better conversations around sex. I think that's very important. And the other goal, or the other goal that I would like is to achieve, to have comprehensive sexual education in our societies, right? Comprehensive, including, sexual orientation, anatomy, the biology, all of that stuff that we, don't really have, right? So in fact, there's, even here in the United States, we don't have to look very far. It's here in the United States, we do not have comprehensive sexual education for our young adults. And so there are multiple states that don't even require that sexual education be scientifically accurate. I don't know if you know that. It's in the Kaiser Family Foundation. They list the statistics of how many states actually have scientifically accurate information. Some states require the mention of abstinence as a form of contraception. Only a few states recommend that we actually teach contraception. So, all of those things really lead to our negative beliefs about sex, right? And leading to sex as this elusive thing that we never understand, and where people are getting their information from pornography. And, I know there's ethical porn, right? But if porn is the only place that people are getting their sex information from, then doesn't say much for us, right? Because what people forget is that sex is, pornography is a lot of theatrics. It's not really reality. And that, that's probably not the best place to learn about sex. So you want a safe space for people to learn and to know and understand, and have evidence-based, scientifically backed, shame-free sex education.
Best sex education that I got in Michigan, when I was there was a woman on public television, and she called herself Safety Girl. And it was really amazing. And she just did a lot of sex education. And I really enjoyed, my husband and I enjoyed her show, and we used to watch it all the time. Non-pornographic and really educational, but fun. So you're right. It needs to happen more and more.
Yeah. And at least there's some more, like we have many more channels of communication and content now, right? So a lot of us are getting a lot of our information from YouTube and Instagram and TikTok. And we're, a lot of us are also sort of like we're following you as well, right? Like there's people out there that are actually, so there's a demand for it. Absolutely. And I think there's at least more content than there used to be.
Some of the best sex advice I ever got, and some of the best sex education I ever got, was from a radio show that used to play on 97.1 called Dr. Judy. And she used to run from 10 p.m. to 11 p.m. every night. And I was in high school. And she was the person that I would listen to for sex advice because she was so thoughtful and tasteful. And people would call in with a lot of their questions. And it comes from places that you least expect it. Sadaf, thank you very much. We want to take a moment to say thanks for coming on the podcast.
Oh, thank you.
And for wanting to dispel the myths around female sexuality, being one of the voices at least, because it's tough enough. And thank you for your honesty. It's important for people to know, for women to know, that I know we're going to stay inside your thought process, but we're not talking to Muslim women only, we're talking to South Asian women. And like Dr. Amna and Dr. Sadaf both said, the best way is masturbation. And that's something that's actually looked down upon in the culture and the community. And it's not just South Asians. A lot of people in general look down upon it. But the reality is that that's the only way you're going to know, by self-exploration. So anyway, thank you very much for coming on and for everything that you're hoping to do. I wish you the best of luck.
No, thank you so much. And thank you for allowing me to be on your platform and being a very, thoughtful platform itself and giving South Asian women a voice. And I think that's very important. So thank you for all that you're doing.
Thank you.
Thank you. Thank you for tuning in to Aurat, where we met yet another interesting Aurat. Visit aurat.com, and we hope you continue listening anywhere you listen to your podcast. Until next time.